Health Show. I'm your host, Madeline Bayre. Remember, the Wholistic Health Show has been coming to you every Wednesday night at 8 p.m. on Bright TV. The Wholistic Health Show is a show whose main focus is to highlight the issues facing the Kenyan medical sector. On this episode, we're going to be featuring all the issues we've handled all season long. Because we value your feedback, talk to us on our social media platforms using the hashtag Wholistic Health Finale on our Twitter handle @HolisticHealthKE and on our Facebook page with the same name. You can also use our text line, that is 22722.
I cannot say that I am great, but I've always dreamt of greatness. To become a great man, you have to be humble, have the right attitude, and to work hard. When I was growing up, I wanted to become like my father. I knew he was an athlete. I realized dreaming was not enough. It takes a lot. You have to make a lot of sacrifices. Be disciplined. If you are strong mentally and physically, you never quit. If you quit, you lose. It feels good when you have the whole country behind you. I know there are a lot of young people looking at us and they want to become like us one day. That is a great motivation. If there is something I can say to young people, my mother taught me with good breakfast and the right attitude, anything is possible. Because when you have a good breakfast, you are ready for the day's activities in order to achieve what you want in life. I don't think you can be the best. Always try to achieve the next level. I am David Rudisha, 2 times world champion, Olympic champion, and the world record holder over 800 meters. Kenya, join me today for breakfast, because with a good breakfast, anything is possible.
You get 3 kinds of moms. The paranoid mom.
No, you could get hurt.
The cautious mom. And the Dettol mom. She only trusts Dettol antiseptic liquid to kill 100 illness-causing germs, and it's recommended for cuts and scrapes. Which is why you can worry less and love more. Don't just be any mom, be a Dettol mom. Dettol, be 100% sure. In partnership with the Kenya Medical Association.
Welcome back to the season finale of the Wholistic Health Show. I am your host, Madeline Bayre. On this season of the Wholistic Health Show, we tackled various issues in the health sector facing the Kenyan people. We highlighted some of the issues facing the Kenyan people and the health sector. We talked about depression, misdiagnosis, overdosing, skincare, dysmenorrhea, and even the stigma and discrimination against people living with HIV and AIDS. Take a look. Depression and anxiety have been termed by the World Health Organization as a global pandemic. 1 in every 4 adults experience depression by the age of 75. Young people of the age 18 to 25 are actually the most affected by depression. The Association of College and University Student Counselors have stated that 56.4% of all university students experience depression and anxiety in their school life.
Since you are a student counselor, how often are you brought to by students cases of depression and anxiety?
Yeah, sadly, very often. In a day, about people who are anxious
people who have a lot of depression cases. You can see even about 4. And then they have different, usually what happens, they have something we call like a presenting problem.
Okay.
So whatever is presenting could be different, but when you dig deeper, you actually find they have a lot of anxiety issues and a lot of depression. So an average of about 4 to 5 in a day. Yes.
5% of all outpatient diagnoses in the world are misdiagnosed. 1 out of every 5 Kenyans who visit a hospital or a clinic end up with the wrong diagnosis. Half of these misdiagnosed cases in Kenya end up with severe outcomes such as disability, maiming, and ultimately death.
I have been misdiagnosed before. I was treated for malaria, but I actually had tonsillitis. I don't know how that confusion really came about, because those are 2 very different things, but I ended up spending around 3 weeks in the hospital being treated for something that I didn't have.
Recently, popular socialite Vera Sidika went on national television to talk about her skin lightening procedure. But this is not a new thing in Kenya, as for ages, women have flocked beauty cosmetic shops and the black market to seek after skin lightening creams or bleaching products. Kenya has been ranked 54th in the world's death by overdosing statistics at 2.21% by the World Health Organization. These statistics are inclusive of overdosing of prescription drugs. With the rise of startup pharmacies and clinics all over Kenya, then overdosing might just become a real issue in the country. The reported case of HIV and AIDS in Africa was in 1960. In 1980, the first reported case of HIV and AIDS in Kenya. In 1998, the then president of Kenya, Daniel Toroitich Arap Moi, declared HIV and AIDS to be a national disaster. Since then, HIV and AIDS studies have been introduced in the school curriculum over the years. Ironically, 36 years on, stigma and discrimination against people living with HIV and AIDS continues.
Also labeled, some of the people will label the HIV positive people as mgonjwa wa ukimwi, others will label them as umeme, others will label them as mokigo, others will label them as sindano, and all those things contribute to the increase of stigma.
2 to 7 days every month, 15% of women all around the world experience severe and sometimes debilitating pain in their lower back and lower abdomen region. This pain is sometimes associated with nausea, fatigue, dizziness, and even fainting. Due to this pain, these women end up taking immense amounts of painkillers, which end up being harmful in the long run.
It starts with minimum pain, pole pole. It starts building up. If you don't take medicine, like in the first, like the moment you notice your new menses, then you're done for, like you're literally done for. So after that, after the pain builds up, nausea comes in, you start vomiting, you vomit, and then there's pain.
If you are just tuning in, this is the Holistic Health Show season finale with me, Madeline Bayren. We're receiving a lot of feedback on our social media accounts and on our text line. Josephine Ngala from Kitengela says, I enjoyed the episode on misdiagnosis. I've been a victim of misdiagnosis before, and it was great that it was highlighted. On Twitter, we have @MarionShire19, who asks, greeting, tuned in, and loving the recap episodes. Will you be coming back with season 2? Yes, Marion Shire, we will be coming back with season 2 next year, bigger and better. Continue talking to us using the various communication platforms on social media and on our text line. Our text line number is 22722. Remember to use the hashtag on social media, #HolisticHealthKE. We will be right back after this short commercial break.
Kwa miaka 61 Omo imetumika nchini Kenya.
Kwa majina naitwa Lucy Karemi. Jana kijana wangu alikuja kutoka shule na shati lake lilikuwa na madoa. Siku ya pili ilikuwa prize giving day shuleni kwao. Nikamwambia tulia, kuna Omo. Omo kidogo, muda kidogo, kazi kidogo, fast action. Na pia haidhuru mikono yangu.
Mom, tulia, kuna Omo.
Omo Fast Action. No one removes stains faster.
Where's John? Strange, never misses trauma with the guys.
Maybe someone getting high.
John won't get to enjoy the water. Too bad for John.
He's gonna miss out on this round.
Hey guys, game has started, man.
You won't watch the big game, huh? You don't get to check out the cheeks, huh?
I heard you went to see some beaches.
John really missed it.
Magical Kenya. We are out there. What about you?
Welcome back to the Holistic Health Show season finale. I am your host, Madeline Baire. Now, let's take a deeper look at the health issues we highlighted earlier on through our expert opinion.
So what are some of the reasons why students experience depression and anxiety?
Yes, some of the reasons why students experience this is that some of them, especially when they go through a traumatic time, maybe sometimes they lose a loved one and that throws them off. So even if they had that anxiety before, it is now like accelerated by that loss. They can lose a relationship, which is also devastating. Matters of the heart are not taken lightly. And you'd think somebody maybe can move on from a broken relationship, but they are not moving on. They keep on being anxious, they keep on going into depression, and some of them even become suicidal. So those are some of the few things, and some of them when they perform, like now the results were released. So based on their performance, their reaction, you'll be amazed. Some people will be like, well, I didn't perform as I would have thought, let me move on. But some of them it becomes like a catastrophe. It's like they can't move on, they get into such a deep depression. So that shows that there was something going on, it just needed an event for it to come.
I had a black dog. His name was Depression. Whenever the black dog made an appearance, I felt empty and life just seemed to slow down. He could surprise me with a visit for no reason or occasion. The black dog made me look and feel older than my years. When the rest of the world seemed to be enjoying life, I could only see it through the black dog. Activities that usually brought me pleasure suddenly ceased to. He liked to ruin my appetite. He chewed up my memory and my ability to concentrate. Doing anything or going anywhere with the black dog required superhuman strength. At social occasions, he'd sniff out what confidence I had and chase it away. My biggest fear was being found out. I worried that people would judge me. Because of the shame and stigma of the black dog, I was constantly worried that I'd be found out. So I invested vast amounts of energy into covering him up. Keeping up an emotional lie is exhausting. Black dog could make me think and say negative things. He could make me irritable and difficult to be around. He would take my love and bury my intimacy. He loved nothing more than to wake me up with highly repetitive and negative thinking. He also liked to remind me how exhausted I was going to be the next day. Having a black dog in your life isn't so much about feeling a bit down, sad or blue. At its worst, it's about being devoid of feeling altogether. As I got older, the black dog got bigger and he started hanging around all the time. I'd chase him off with whatever I thought might send him running. But more often than not, he'd come out on top. Going down became easier than getting up again. So I became rather good at self-medication, which never really helped. Eventually, I felt totally isolated from everything and everyone. The black dog had finally succeeded in hijacking my life. When you lose all joy in life, you can begin to question what the point of it is.
So depression usually has like 9 symptoms, and most of the time it's when you have lost meaning in life. You wake up with feelings of hopelessness, helplessness. You no longer take joy in the things you love doing. You sleep too much or too little. You eat too much or too little. Those are the kind of things. And it has to be, those symptoms have to be persistent, like over about 2 weeks. So when we have done your history, when we ask you questions and you kind of go towards that direction, we might be diagnosed as depression. But it's not like one day you wake up and you're feeling the blues and you're depressed. And anxiety is like they are always on an alert. Their heart is beating, their heart is racing, they are sweating, they're just not at peace. So those are the kind of things, when you have noticed that these kind of symptoms are continuing, persistent, you know the way they say, your symptoms persist, consult a doctor. So if you've seen that in your life you have these kind of symptoms and they are persistent, kindly consult with a doctor or a psychologist, and then he can help you to get the treatment.
So what are some of the cases that are misdiagnosed in Kenya? What are some of the diseases that are misdiagnosed?
In Kenya per se, a study has not been fully done to see the most commonly misdiagnosed conditions.
Jitambulishe.
Mimi naitwa Masi Hakasa.
Kutoka wapi?
Kutoka Kakamega.
But on some conditions like asthma, cancer and TB, it's alleged that there are some misdiagnoses made on those conditions.
What are some of the factors that cause these cases to occur? What are some of the factors that cause misdiagnosis cases to occur?
The factors can be divided into two: patient factors and doctor factors. On the patient factor, we have most patients when they come, they don't fully explain themselves, or some might hide some crucial information that you need to make the diagnosis with. Yeah, mostly on the patient side. On the doctor side, skill-wise and specialty. As you know, there are so many clinics that are opening up. Most of them are not qualified doctors or people that are registered. And they are seeing patients. So mostly for there, you will not get the actual diagnosis that you need and the treatment that you're supposed to get. Also on equipment wise, there are some places where you can't do lab works to confirm the diagnosis.
The skin. Tell us about the skin. I mean, we touched on it, most of us who went through the education system touched on it in biology, but is there more to the skin other than, because all I know about the skin is the epidermis and the dermis, so just tell us about the skin.
Body has three main layers: the epidermis, the dermis, and the subcutaneous layer. Subcutaneous layer is the fat that you have, let's say the fat content in your body. The thicker it is, the more you're cushioned to. If you fall, you don't have injuries, fractures and all, yeah. Then the epidermis has 5 layers: the stratum corneum, stratum lucidum, stratum granulosum, spinosum, and stratum germinativum. And then the dermis has 3. So generally that's what is under the main epidermis skin.
You have people saying that I have normal skin, or I have dry skin, or I have oily skin. What are some of the different skin types that people have, and what can you do to know your skin type?
We have 5 different types of skins. We have the normal skin, the oily skin, the dry, sensitive, and combination. So for the oily skin people, most of the time they have acne, if I have to use. They have so much breakouts, and then their pores are really open. If you check on their skin, their pores are more open. So that's exactly opposite of what dry skin are. Their skin is tighter, and then for their skin is not looking glowy and some look of shininess in their skin, because their skin is totally dry. Combination, you either have normal oily, normal dry, or dry and oily, where your skin is dry completely, and then some parts of it, like probably mostly on the T-zone, the T-zone is this area. On the T-zone, it could be oily or dry, and then the rest of the skin is different. Where you have combination, where you probably develop more acne here, and then the rest of the skin is okay. Then the sensitive people have so much sensitivity on the skin. So if you touch a person who has sensitive skin, most of the time they have a breakout or develop some problems with their skin.
When should someone use sunscreen? Because especially in Africa, because when people think of a sunscreen, they think of Americans or the people going to Mombasa. But the average mwananchi who's not white or doesn't go to Mombasa, you find that they'll not use sunscreen. So what is the place of sunscreen in the black people's skin?
I think melanin is what determines our color. So we think because they're white, they use sunscreen because they have no melanin and stuff, which is, they have melanin just in less content. The melanocytes produce less melanin. So we all need sunscreen. That's the first thing I should say, because at different levels Like, for example, if you're here in Athi River, the sun is really hot. So if you're here and compared to a person who's in Kiambu, they may not need a sunscreen as much because probably they're not exposed to the sun. Here we go for classes, of course, from morning till around 4 or 3:30. That's the time the sun is really hot. From 10 to 3, the UV rays are very high. So I would really recommend everyone to use a sunscreen. They have different sun protection factors. It ranges from 10 to 60. So the higher you have melanin and the higher you're in maybe a more hotter place, you use a higher SPF. Yeah.
So we've seen socialites Vera Sidika go on national TV and talk about bleaching and how it's skin lightening and it's better than the bleaching done in River Road or in such products. So how effective are these products for one, and what do you think can be attributed to why people are really bleaching a lot, in your opinion?
I think in my opinion, most of these socialites are what we are getting as beauty. You know, in a society we depended so much on the outer beauty than the inner beauty, which if I'm beautiful from the inside, I believe it comes out on the outside. A smile a day makes everyone look beautiful, so why not? Then I think really bleaching has some really serious effects because first of all, in some of these products that are being used, for example, like a place in China, there's some tablets they give you. You go there, you're looking really aging, but give me 1-2 weeks, I'll be looking a very young person. I don't want to give examples, because I've not been allowed to, but I know, and then one thing for sure, you can't lighten your whole skin. Your knuckles, your knees, your elbows will always be dark. So if you change that, every person will still know Madi bleached your skin. So I think with time, it's not really encourageable to bleach your skin. I think.
John, what is the importance of taking the right dosage of a drug?
For the optimum result or the outcome of a proper treatment, because different treatment got different dosages.
So Mr. John, why do people misuse prescription drugs?
People do that maybe for spirit of adventure. Some want to experiment. There are curious people who want to do their own stuff. Other people can take more than prescribed dosage to get maybe a particular side effect of that particular medicine. Maybe drug is giving sleeping. It can give you a good sleep, and a client can overdose to get that effect. Other times it can be done unintentionally, like patients is unaware that they are doing overdosing. Yeah.
And so what do you think are some of the consequences of abusing or overdosing on prescription drugs?
The optimum consequences for overdoses can be death. Okay. It can be either short-term or long-term consequences. Like for example, you take morphine or like this, for example, if you take NSAIDs, paracetamol, ibuprofen, it can bring a long-term effect like kidney problems. You can, at the end of the day, get kidney stones. It can bring other central nervous system problems like confusion, something like epilepsy can be as a result of overdosages.
So then, what are some of the commonly overdosed prescription drugs?
For example, benylin with codeine syrup. People are taking that just to get high because of euphoria. It has a sense of comprehensiveness and feeling good. Other drugs that are overdosed, like paracetamol, they are taking unwanted for treating pain that even doesn't respond to paracetamol. Other like chlorpheniramine, because of good sleep that it gives. Being an anti-allergy, people are taking it to have a good sleep. So people are just taking advantage of the side effect. These are two examples of most commonly used overdosed medication.
Okay. So what is dysmenorrhea?
Dysmenorrhea is painful menstrual periods.
What causes dysmenorrhea or menstrual cramps?
The causes, there are primary causes and secondary causes.
Okay.
First cause, the primary causes in young women, which occurs without any underlying problems. For example, it is most commonly in those women with irregular periods, periods that started before 12 months, years, and with those with the low birth weight. So those ones are left to getting painful menstruation. The other one, the secondary cause, is most common in older women. This could be due to when growths in the uterus, like fibroids, and also those women who use coils, the birth control contraceptives. We also liable to getting the heavy periods or painful menses. There are also those who use have recurrent STIs. They also are likely to get dysmenorrhea. People who are stressed and have anxiety, they also likely to get it. And those with unequal leg length, there are people with one leg is a bit shorter than the others, and you will not notice it. But when you see us examining you, we try to put our legs together. We want to see how your legs are. One is shorter than the other. What I would like to add to the causes, let me say, there are some people, less than older women, not necessarily the older women. These young people also, they get fibroids. And you have very many painful menstruations. So there's no cause found. But when you are assessed properly, you find that you have some small fibroids. So in a case like that one, painkillers will not help. Or if you have infection in the uterus, you have, like there are people who stay with the panty throughout the day, they don't change. Maybe you went to class, you forget to carry one. So you are about to get infection through blood. You know, blood is a very good media for transmitting infection from outside to inside. So at least personal hygiene is very necessary when you are on periods. So if you get those conditions, STI, that one will not help. The painkillers will not help you much. So we have to accompany with another antibiotic.
Stigma and discrimination, we can define stigma by saying that it is a feeling of utmost rejection, and this rejection is both internally and externally. When they come to HIV positive persons, they first feel they go through the stigma, or they suffer the stigma, and they have great fear. The reason as to why they feel they are stigmatized is because they have great fear of what will happen to them just in case they disclose their HIV status to other people, whether relatives or even friends. The other thing I would like to mention here is that they suffer internal rejection, and they also suffer shame, and they start to withdraw slowly from the rest because of what they go through.
So, is there stigma and discrimination in Kenya?
Yes, stigma and discrimination is still there in Kenya.
Wow. How does stigma and discrimination against people living with HIV and AIDS happen?
How stigma and discrimination happen is the infected people. When I say the infected people, I mean those who have been tested and they are HIV positive. So the infected people have been discussed openly, maliciously, but not to be helped. People just talk about HIV positive people, they gossip about them, they just discuss them maliciously, and yet they do not help them at all. They are also labeled, some of the people will label the HIV positive people as mgonjwa wa ukimwi, others will label them as umeme, others will label them as mokigo, others will label them as sindano, and all those things contribute to the increase of stigma. They are also openly avoided and secluded when they are HIV positive, even by close friends, even by relatives, and that thing really affects them completely. They are also neglected to a point of being denied food and even medical care for those medics who do not understand exactly what HIV means, or actually the mode of transmission. They really do not treat them well. And when they are sick and they need attention, some of the medics will attend them with the polythene papers. Some of them will even wear double gloves because they think they can be infected, even when it is not necessary. Even when like they are giving the drug orally, instead of just using bare hands to hand over those drugs to the patients, you will see them wearing gloves because they think by handing over those pills to the HIV infected, they can be infected, they can contract the HIV themselves. And therefore the patients lives in seclusion, even in the midst of others, living on their relatives and even the medics. I also want to say that sometimes even the church seclude them. At times we will see when they know there is a specific member of that church who is HIV positive and he or she has occupied a certain row. Some will either move from that row or actually go to another place.
How has stigma and discrimination affected the spread of HIV and AIDS?
The most important thing in HIV is the issue of disclosure, because once they disclose, they are able even to take their medicine the right time and the right dose. And because of the fear of stigma by others, including their relatives and even their friends, sometimes the people living in HIV AIDS, they choose not to disclose. And when they choose not to disclose their status, this definitely means they will not even disclose to their sexual partner. And therefore, instead of like when they are having sex, because they have not disclosed their status, they will not use any method of protection, and hence they will infect others who probably are not yet infected. They will also not disclose, and therefore this might affect their caretakers, because instead, just in case they have wounds, they can transmit the same to their relatives because of the issue of not disclosing. The other thing that affects is the issue of revenge. When they are angry, they revenge, and they normally say, because people do not love us, because people are talking about us, what we are going to do, we are not going to die alone. We are going to revenge, and therefore we are going to have sex without protection and make sure we infect as many people as possible.
So why do people, and it's been 36 years since HIV came to Kenya, still discriminate against people living with HIV and AIDS?
Exactly. 36 years down the line, and we're still trying to fight stigma. We are not yet there, and mostly it's because of the myths. There are so many myths in this country, Kenya, that most of those who do not have the proper information think that those who are infected with the HIV virus are prostitutes. They also think that they are sinners, and especially in the church. Some of the church still believes that HIV is only for the sinners, and those who are saved or those who think they are righteous, they cannot get infected. And this is not the truth. This is a big lie. Of the churches still believes that HIV is a curse, and actually it's for sinners only. For those who are not saved, they can get it, but for the saved, they cannot get it because this is purely for the sinners. There is another myth that the HIV virus, you can only get it from unfaithful partner. And therefore that is why it is still there 36 years down the line since it was discovered in the country Kenya.
The tastiest blue band now comes with omega-3 and 6. So important for kids' growth and development. and tell them from whom then home. Give your kids the omega-3 and 6 they need. Now available at selected outlets.
Hello, I'm afraid I have some bad news. And some good news. Do this. That furry feeling? It's harmful bacteria, and it's making harmful little bacteria babies in your mouth. I call it the fur factor. Fortunately, there's good news. Colgate Total.
Its unique technology bonds to 100% of your mouth surfaces, providing superior protection for 12 hours.
Fight the fur factor with Colgate Total.
The Holistic Health Show was always about you, the Kenyan people. Therefore, we always sought to find out your views and opinions on the various issues. Take a look.
Wanawake wanajipaka mafuta, yani wakijibleach, yani ndio wakuwe warembo zaidi, yani hata wakitembea mtu anaona kweli huyu mwanamke ni mrembo kabisa, kwa sababu amejibleach, amekuwa mweupe sana.
What's your opinion on the whole bleaching craze going on in Kenya?
I think it's a crying shame. It's unfortunate that people are not satisfied with the way they were made by God, and they feel that they have to lighten their skin. And yeah, I just think it's sad.
What do you think are some of the consequences of taking more than the prescribed amount of a drug?
Honestly, one, death, because the more drugs you take, you're gonna die. And then like other complications like misdiagnosis. Okay, you'll treat what you don't need to treat due to taking so much of that medicine. Yeah, and then what else? Other complications that I honestly do not know about.
What is misdiagnosis according to you?
I think misdiagnosis is, should I define it as a process, or I think misdiagnosis is the act of a medical specialist giving a wrong diagnosis according to the symptoms they've seen in a specific patient.
So have you ever gotten the wrong diagnosis?
Severally. Many times, especially with common diseases. When I get a cold, I'm given a lot of antibiotics. Tell me, oh, you have this and this, you have a flu, you have that. And I end up getting strong medicine, which even affects me more. So these days, I'm very, very careful on who I go to see when I'm feeling sick.
Okay. High school, secondary school, it happened because of family issues, just overwhelming, and then campus also because of grades. It happened quite a few times, but yeah, you get over depression.
Would you employ someone with HIV?
Yes. Yeah, because it doesn't determine how much the person will do the work. It doesn't say that if you're HIV positive, you must work in a certain way. You can still reach your potential.
Okay, and would you be friends with someone with HIV?
Yes.
Yeah, of course.
In this modern day and time where there's medicine and all that, I think it's just fine to try.
Okay. So last question, would you date someone with HIV and AIDS?
No.
Yeah. Okay,
not unless I'm positive, it's fine. If I'm negative,
but there are some who do this,
zone.
as in you get someone who's negative and positive because they follow what the doctor has told them on how to prevent them from getting HIV. I don't think it's that's.
On the first part of the show, we looked at the various issues facing the health sector in Kenya today. But what are the solutions?
Should someone do? So I have seen that I don't want to see people, or maybe I don't want to eat, or I'm eating too much and I'm feeling so sad and hopeless for 2 weeks. So what should I do? Or maybe I'm feeling so anxious, I'm feeling like I want to faint, my heart is racing so much for so long. What should I do?
Yeah, that's why it's important to have people around you, very supportive, people around you who know you. Because maybe your roommates can be like, hey, what's up? You are feeling sad, you're not interested in the things you used to do, and it's not one day, it has continued. And then maybe your family also notices that you're no longer the happy person, or you're always anxious, you're always, something is off. So when people around you also notice, then that is also a point of concern. So talk about it. Most people now when they go through such, some of them want to withdraw, some of them are into denial, and they're like, everything is fine, my life is okay. But you can actually feel your life is not okay. Talk to a close friend, talk to a close family member, and if you want, you can now come and consult with us as counselors. That's why we are here. We are here to listen to you, we are here to walk with you, and we are here if need be to have that intervention. Because most of this anxiety and depression unfortunately come because the stress was not managed before. Because you see, it was small things, you didn't manage them, then they escalate and become bigger. It's like when you have a disease, if you don't treat it in time, it now unfortunately grows and becomes something else. So the same with us. So most of those small stresses, some people don't know how to cope with stress very well. You go and fail a cut, it's the end of the world. So that's why we encourage you to learn how to cope with those small things before they become big.
Eventually, I felt totally isolated from everything and everyone. The black dog had finally succeeded in hijacking my life. When you lose all joy in life, you can begin to question what the point of it is. Thankfully, this was the time that I sought professional help. This was my first step towards recovery and a major turning point in my life. I learned that it doesn't matter who you are, the black dog affects millions and millions of people. It is an equal opportunity mongrel. I also learned that there was no silver bullet or magic pill. Medication can help some, and others might need a different approach altogether. I also learned that being emotionally genuine and authentic to those who are close to you can be an absolute game changer. Most importantly, I learned not to be afraid of the black dog, and I taught him a few new tricks of my own. The more tired and stressed you are, the louder he barks, so it's important to learn how to quiet your mind. It's been clinically proven that regular exercise can be as effective for treating mild to moderate depression as antidepressants, so go for a walk or a run and leave the mutt behind. Keep a mood journal. Getting your thoughts on paper can be cathartic and often insightful. Also keep track of the things that you have to be grateful for. The most important thing to remember is that no matter how bad it gets, if you take the right steps, talk to the right people, black dog days can and will pass. I wouldn't say that I'm grateful for the black dog, but he's been an incredible teacher. He forced me to reevaluate and simplify my life. I learnt that rather than running away from my problems, it's better to embrace them. The black dog may always be part of my life, but he'll never be the beast that he was. We have an understanding. I've learnt through knowledge, patience, discipline and humour, the worst black dog can be made to heal. If you're in difficulty, never be afraid to ask for help. There is absolutely no shame in doing so. The only shame is missing out on life.
What can a patient do to maybe just avoid or prevent to being misdiagnosed?
So on the patient side, when you are visiting a doctor, you explain fully what is happening to you. And in case you are not satisfied with what you're being offered in terms of the diagnosis and treatment, you're also able to seek a second opinion. Doctors, we need to be keen, especially on history taking, spend time on examination and send for the adequate lab investigations that are help you reach a diagnosis.
Whatever you eat is whoever you are. That's what they say. And I think it's really true. If you really feeding, you don't feed on water and everything. Most of the people who feed on really good water or a good amount of water, they have really very glowy skin. So I think water and whatever you eat, fruits, they really give those nutrients and rejuvenate your skin. Yeah, you build it from the inside. It's not beauty from outside. It's from the inside to the outside.
So what do you think is the solution to overdosing on prescription drugs?
Solution lies to a client, doctor, pharmacist, ethics. You just need to do what's right and avoid overdosing. And it's entirely lies to, most of the time it's a patient that are doing that, because I don't think doctors will do overdosing unless it's an error which should be rectified at the pharmacy. But for the patient, ethics plays the role there.
So at what point should the pain get to before you see a gynecologist?
Now, if you get increased discharge, because of maybe the infection, could be, you could, like we said, if you use a pad for a long time without changing, that one can lead to, you also feel the smell. So if you get infected, then that time you should see the gynecologist. If you bleed for more than But 3 months, you bleed a lot for 3 months. Then see the gynecologist. If you pass out the clothes, blood is coming out in clothes. See a gynecologist. If you take medicine and this pain is not going away, please, we can have to see a gynecologist.
What can be done to stop or reduce the stigma and discrimination?
Yeah, there is something that we can do as a country. The first thing we need to do is that it is possible for us to reduce stigma. It is possible for us to reduce stigma because the first thing we need to do is to seek the right information. And when we seek the right information, we should also dispense the same. The Bible says in the book of Hosea, my people perish because of lack of knowledge. So we need to give our people knowledge. We need to disseminate the same so that we can all know how HIV is transmitted and actually how it is not transmitted. We should also be very careful when dealing with HIV positive. We should first of all deal with our own judgmental attitudes, because many a times we have judgmental attitudes. It's because she was a prostitute, it's because he was doing ABCD, it's because he was a sinner, and ourselves within we are holier than thou. So we should deal with our judgmental attitudes. We should also facilitate communication between the caregiver and actually the infected, and giving them a chance to express their feelings and frustrations. You see, when the infected feel like they are low, sometimes they are not happy, we should listen to them, we should talk to them, we should encourage to them, and we should just work with them and give them an ear. We should listen to them. We should also not impose our own values on the patients, because many a times when we are attending patients, some of us medics, we forget that we have our own values and the patients, they have their own values. We shouldn't impose our values to our patient. Again, we should continue with education. We always say education, 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 and therefore we should continue educating our patient, not only our patient, but even the family members, because again, this patient comes from a family. We should also educate the entire community so that they can understand what services are available, so that they can take their patients to services like ARVs, how to live positively with ARVs. We have support group, we call them psychosocial support group for those who are infected, whereby they go, discuss their issues, encourage one another, encourage each other. We should also have counseling services, and we should also make sure that both the infected and affected are aware that we have such services.
When people look at me, they see what they want to see. They don't really know me. They don't look past the surface to what's inside. Am I pretending? Or are you just too blind to see that there's so much more to me? There's something unique inside me. That thing that's so rare, that makes me me. I let go when you're not looking. When you least expect it, I surprise you. Because the only time I'm truly free is when I'm just me. See my true colors. See the true me. Trust condoms. Kuwa true.
Wow, I like your pictures. You should frame some.
Thanks.
But what's with the skin breakout?
I try to keep my skin beautiful through a daily cleansing routine using beauty soaps, but
everyday exposure to dirt, germs, and sweat makes our skin susceptible to an outbreak of rashes. That's why I started using Dettol skincare. Only Dettol skincare contains the right balance of moisturizer and 24 hours non-stop protection from germs. Dettol skincare enters deep within your pores and removes germs. That leaves it feeling smooth and even-toned every day. Wow, your skin looks lovely.
Yes, you look radiant and beautiful.
thanks to Dettol skincare, now I have the face to face the world. If we don't take care of ourselves, who will?
New Dettol skincare for beautiful germ-free skin. Now also available in shower gel in partnership with the Kenya Medical Association. Dettol. Be 100% sure.
From the first time you saw her and the first time she saw you. For the first time he tasted something good. And the first time you knew he had good taste. For the first time she slept through the night. And the first night that she didn't sleep at all. Only a mother will ever know everything a child goes through in the early years, and we are proud to share those memories because we were always there with you. So Soft Fabric Softener, the scent of beautiful memories.
We have come to the end of the finale episode of the Holistic Health Show. I would like to thank you for your continued support and feedback throughout the entire season. Let me read out some of your comments coming in through social media and our text line number. We have @Kichwata Kenya on Twitter, who has said, loving the finale show, quite informative. Marcus Ngaru on Twitter again is saying, interesting topics. Could you do a piece on male health next season? Sure thing, Marcus. Next season will be bigger and better. Miss Taru Kananu on Facebook has said, I have been a fan of the show since episode 1. I can't wait for season 2. Text messages have also been coming in from all various parts of the country. And we have a text message from Rotich from Eldoret saying, great show. I have learned a lot throughout the entire season. Thank you so much, Rotich from Eldoret. And thank you all for all your feedback and comments coming in. That is all we had on this finale episode of the Holistic Health Show. We are coming back in season 2 on Bright TV, bigger and better. I have been your host, Madeline Bayre. Good night and God bless you.